Hello everyone. Today I'll be discussing a topic which has become a necessity and a convenience for many of us, not only in India but around the world, and that is laser hair reduction. Hi, I am Dr. Rajat Kandhari, consultant dermatologist from New Delhi, Dr. Kandhari Skin and Dental Clinic. And today I'll be discussing some of the myths associated with laser hair reduction. So starting off with the first myth, and that is waxing or threading better than laser hair reduction? So I'll tell you the basic difference between both the entities. Now, when you wax, thread, pluck, epilate your hair, what are you doing? You're pulling the hair out of the root, right? When you pluck your hair out from the root, what it does or what it tells the follicle or your body is to start a new hair cycle. Now, if this becomes a repeated issue, pluck again, what will happen is your hair will start becoming thicker in diameter and it will lead to a thicker growth over a period of time in many instances. What laser hair reduction does, on the other hand, it acts on the pigment in your hair, on the black color of the hair. So, over a period of time, once it hits that black color, it tends to thin the hair down. Waxing and threading, thicker hair; laser hair reduction, thinner hair. What do we want? We want obviously a thinner hair. The time in which the hair comes back after laser hair reduction will only tend to increase with a period of time in most cases, right? So we've got a thinner hair and we've got a hair which comes back in a longer period of time. So obviously laser hair reduction appears to be a better bet. Secondly, doc, my daughter, she's about 14 years old. She's got a lot of hair on her face. She's not talking to her peers. She doesn't like going to school. What should I do? In other words, what's the youngest age to get laser hair reduction? Now, while globally there is no right answer for this, there are times when we tend to do laser hair reduction at early ages for more therapeutic reasons, but we weigh the risks and benefit. Mostly it is said that 2 years post starting of your menstrual cycles or menarche is a good time to consider laser hair reduction because you're hormonally more mature. But there are times when too much hair on the face is disrupting a person's quality of life, in which case, under supervision of a dermatologist and endocrinologist, we can consider laser hair reduction to give a better quality of life to the individual, right? Thirdly, doc, I have had many sessions. I have had some 10 sessions, but my hair doesn't seem to go away. Or, doc, how many sessions will I need before you start the laser hair reduction? First and foremost, it's laser hair reduction, not laser hair removal. So, reduction process means we decrease the amount of hair, we make it thinner, we make it lesser. However, all the hair does not go away, and you should know this before you get into this procedure. Why does that happen? That happens because your hair follicle has an area which has stem cells. Now, what do stem cells do? Suppose my liver gets an injury, the stem cells, what do? They repopulate the liver and they give it more function and they help it heal. The same way, when I hit my hair follicle with my laser beam, it injures it and it also quietens the stem cell down, but it does not destroy the stem cell. It makes it like a dormant volcano. So it's quietened down. So the laser hair reduction causes hair to come back in a longer period of time, but the stem cells repopulate the follicle and some of the hair will come back. So there is no good answer for this. However, there are certain areas such as the jawline, upper lip, chin, which require repeated sessions and may be a little more stubborn depending upon the kind of hair that you have, depending upon the kind of ethnicity or racial background that you come from. However, areas such as the underarms, the legs and the arms, they tend to do a little better. Fourthly, doc, I have very thin hair. Can I get laser hair reduction? Like I said, the first thing, what does the laser target? It targets the black color in your hair. So if you've got a thick and coarse hair, great, you're a great candidate for laser hair reduction. But if you've got a very fine and thin hair, you might struggle and may require more sessions to hit it and get the optimal outcome, right? Doc, I got some 15 sessions, but my hair has become even more than what it was. A common thing. Now, when does this happen? This happens typically when you use suboptimal energies. That means Rather than the right amount of energy which was to be used, you use energy which is low, or you go outside the demarcated area. So you give a little energy outside the area to be actually lased. So what does that do? That triggers or stimulates hair growth, also known as paradoxical hair growth, which is common with lasers, common in places where there are no doctors, in spas. So please visit a dermatologist or a certified specialist when you go for this procedure, because it'll just take a longer period of time if you're doing it elsewhere and not in the right place, right? Doc, please use the laser which is painless. Now, as a doctor, no doctor wants to give their patient pain for obvious reasons. However, pain, remember this, that pain is a necessary evil with laser hair reduction. I don't mean that you'll be crying out or shouting in pain, but why is it a necessary evil? Because we need to heat the hair to 65 to 70 degrees, the follicle, for it to be effective. So if I'm giving you a laser which is completely painless, like completely, you may want to think again that, is this really doing the job? So you might feel a little heat, might feel a little pinching, and this particularly happens early on when your hair is thick and not so thin. Once your hair becomes thinner, there is not so much heat that you feel and you're pretty all right. So I hope this video answered some of your queries associated with this ever so common procedure that is called laser hair reduction. I wish you a hair-free future. Thank you.